Miss Nancis was diagnosed with multiple fibroids at age 20. She later had them removed, so she can now live a more normal life. Clarice's experience is shared by many other women in Trinidad and Tobago who are affected by uterine fibroids. They are the most common type of non-cancerous tumors and grow in the wall of the uterus, the womb. They may range in size from a pea to a grapefruit and generally affect women between the ages of 20 and 40. Dr. Mariel Armstrong says the condition can cause women to experience a range of symptoms that affect their day-to-day activities.
With uterine fibroids, 50% of women are asymptomatic. That means that they can present with no fibroids, and whereas the other 50% are very symptomatic. These symptoms include pain, and as Mrs. Nancy said, they can present with back pains, lower pelvic pains, and also they can present with heavy bleeding. And this bleeding is when the ladies are seeing their periods.
Statistics show fibroids are most prevalent among women of African descent. Risk factors include obesity, diabetes, and lack of exercise. Medication is prescribed to manage the pain, and there are also drugs that shrink the growths. Surgery is also an option.
In terms of surgical management, you can have myomectomy as well as hysterectomy. Hysterectomy is when you are removing your entire uterus. Myomectomy entails the doctor removing the fibroids that are embedded in the muscular part of the uterus.
In 2014, it was found that 45% of women visiting the gynecology clinic at the Scarborough General Hospital had uterine fibroids. So it's important to educate the public, especially young girls, about the condition. This was done via the Confidence Project, an initiative of Fibroid Awareness Trinidad and Tobago that took place during the last school year at Signal Hill Secondary, Bishop's High School, and Speyside High. The students shared what stood out for them during the presentation.
At least they say when we have the fibroids, if it's not like plenty, we can still make children.
You doesn't know what's going on, you need to learn about your body because it could lead to infections.
Women are encouraged to talk with a doctor about any pain they may experience. This information can help them make the best choice for their health. I'm Omodara Mills for Let's Talk Tobago.